It's my pleasure to call our colleague Melissa Darby to the podium to talk about mental wellness and atypical aHUS. Melissa is currently a social worker at the Hospital for Sick Children, working with children, adolescents, and families in both inpatient and outpatient settings, specifically within inpatient nephrology, chronic kidney disease, and dialysis. Melissa graduated with her Bachelor of Social Work in 2021 from McMaster University and received her Master of Social Work in 2023 from the University of Windsor. She has worked within her role at SickKids for 2 years now. She has previous experience working in adult dialysis, child protection, pediatric eating disorders, and the Housing First program. Melissa is a fantastic colleague, a wealth of knowledge, and we are really looking forward to your presentation.
Thank you. Okay. So thank you, Dr. Licht, for introducing me. So today I'm going to talk about mental wellness in aHUS. So as you said, I'm a social worker at the Hospital for Sick Children, working with children, adolescents, and their families with CKD, hemodialysis, PD, and then also in an inpatient setting. So first, I thought I would just talk about what mental wellness actually is. So there's a lot of different definitions out there about mental wellness and mental health, but I chose the definition from the Global Wellness Institute, which is on the screen now. So they say that mental wellness is an internal resource that helps us think, feel, connect, and function. It's an active process that helps us build resilience, grow, and flourish. So by finding ways to support our own mental wellness, we are also building protective factors for our mental health, as well as reducing potential symptoms or severity of mental health challenges. And that also connects to our physical health as well. So wellness can look different for every person, and approaches to mental wellness will also vary across time and different circumstances. So for example, in your different life stages, we have different challenges that we might face. Mental wellness can also be about prevention. So how do we cope with life adversity when it comes up, and being resilient when we face those hard emotions. And it can also lead us to flourish in ways that matter to us. It's about managing stress, building healthy relationships, and also making positive choices, while also contributing to a fulfilling and balanced life. Mental wellness is not always about being happy, but rather about effectively navigating life's challenges and thriving in good and bad times. So now thinking about the impact of an aHUS diagnosis. So as we know, everyone's experience with aHUS is unique. The common emotional responses that people might feel is anger, frustration, thinking, why me? Worrying about the future, grieving about certain aspects of your life, feelings of powerlessness, thinking about worst case scenarios, and also just thinking that you're no longer you, but your medical condition. There can be a buildup of stress within different aspects of life from a new diagnosis. So, for example, economic changes, missing work, missing school, changes to lifestyle, a sense of isolation or a lack of understanding from people around you, and also, like I said, kind of feeling that change in the sense of yourself. So like I said, everyone reacts differently, and the degree of distress can kind of depend on multiple factors, including your age and personality. And the emotional upheaval can make it difficult sometimes to function or think straight. I just want to highlight that any response post-diagnosis or during the diagnosis is a valid response, because everyone's feelings are valid, and there's no right or wrong way to respond to a diagnosis. We often feel a wide range of difficult emotions, which is normal. It doesn't mean because we have those difficult emotions that we're not going to be able to meet the health and emotional challenges that come later on ahead of you with your diagnosis. It's also important to remember that you're not powerless in this situation. Oh, sorry. It just zoomed in. I lost my part. Oh, here. And that you can take steps to better cope with your new or continued situation and learn how to navigate this challenging new or continued journey. I also like to highlight that there is limited data on the psychological outcomes of aHUS. So based on the studies that I had found, there is indications of high level of anxiety and overall stress symptoms in both patients and relatives. There's also findings that suggest high rates of mental health symptoms, PTSD, and also quality of life alterations in patients with aHUS post-admissions to ICU units. I'm not able to cover everything in this presentation, but I also would like to mention that past and current trauma, either related to medical trauma or outside, can also influence the way that we're coping and that we approach situations. It can shape how we respond to care, how we make decisions, and how we also process new health information when it's given to us. So it's also important to acknowledge those larger feelings. So what can I do? I've written down, this is really general of kind of things to promote mental wellness when coping with a chronic health diagnosis. So this is just a few different ways that we can kind of support our mental well-being and learn to cope with the diagnosis. It's not a comprehensive list by any means. And like I said, everyone is individual, so it's whatever makes sense for you. So first, reaching out. I think the fact that you guys are all here shows that you're already reaching out, right, to a community, and you're trying to get connected to people who have either experienced this, have been in these scenarios, or also just different experts who have also navigated this with patients as well. So when facing a new or chronic diagnosis, it can often make you feel alone or cut off. It can feel like no one understands what you're going through. And also sometimes that people are kind of too positive, and it can be hard to tell them your real feelings when they're just telling you, oh, be positive, it'll be all okay. It's okay not to be positive all the time. This is difficult, and they're hard things to cope with. However, social support can have a huge impact on your mental wellness and health when facing the stress of a medical condition. It's up to you kind of what that support looks like. You don't need to share with everyone what your diagnosis is. That's up to you, who you want to disclose to. But it's often helpful to have people kind of in your corner who know what's going on and can support you through that. Other places that could be helpful, we're all here, so we see that, but also different support groups, peer support groups, or also just professional help as well, whether that's through a family health team, through the hospital, or in the community. At the end of the presentation, I did include a list of different peer support and support groups within Canada with both kidney disease and aHUS. So some of the groups may not be specific for patients with aHUS. Okay, so next is allowing yourself to feel and explore your emotions. So we find often most people, it's easier just to avoid experiencing the emotions, but they're going to exist either way, whether we deal with them now or we deal with them in the future. You might think that bottling up the emotions or forcing yourself to feel positive will give you the best outcome. However, acknowledging the negative emotions won't negatively impact yourself or your health. It can actually help you in facing this. Often when we internalize or ignore these feelings, it actually leads to more unpleasant feelings later on, including increased stress. But we often all learn to bottle up our feelings in childhood. So it's a thing that a lot of people learn, but it's never too late to reconnect with your emotions and your body and learn how to explore those emotions and address them. Also, when we feel these big emotions, we often feel it in our body. So for example, with anxiety, you might feel stomach butterflies or tense muscles when you're feeling loss. We can learn how to concentrate on our physical feelings in order to explore the emotions connected to them. And then, as I mentioned before, there's also a relationship between our mental health and our physical health. So managing and supporting our mental well-being can actually improve our quality of life and also decrease symptoms sometimes. For example, with chronic stress, that can impact our blood pressure control. So all these things are connected to each other. Okay, so how to cope with mental health symptoms. So it's okay to feel worried about your health and also grieve the things that may change in your life, and also to acknowledge some of the thoughts and fears you might have are valid. And on the other side, they don't need to consume you. So both statements are true. That's valid, and it doesn't need to be the only thing that's consuming you. So it's normal to worry about the future or feel apprehensive about medical needs such as treatments. But if these feelings are impacting your daily life, you could be dealing with more excessive feelings of anxiety and depression. Through a study, a different study actually completed in the Netherlands, patients with aHUS highlighted they often search for ways to gain control over the situation, with one patient stating the inability to control the situation that was for me personally the most difficult. In this study, it was found that overall understanding of aHUS was considered to contributing to their sense of empowerment. So when we have the knowledge about our health conditions, it can also give you more control over the situation. So once again, I think being here and having these conversations and asking these questions can also help improve our mental wellness, and asking the questions that we have rather than keeping them in. And then you can't stop worrying entirely, but we can find ways to manage our thoughts and behaviors. So this could be through setting time aside to worry, challenging negative thought patterns, identifying what's beyond our control, trying to gain new information and ask questions, using exercise or meditation to interrupt the anxious spirals, and opening up to others as well. Telling yourself to just stop worrying doesn't work. We all do it, but it never works. It might work in the moment, but those thoughts are just going to continue to be there if we don't address them or at least talk to someone about them. So how can we manage or challenge these thoughts? So often the super challenging thoughts that we experience that impact our daily life or our ability to cope are often thought of as like thinking traps or cognitive distortions. So it can be overestimating the possibility that things will turn out badly, jumping to the worst case scenario, or treating our anxious thoughts as facts and not thoughts. These aren't based on reality, but they're also not easy to give up when we're thinking about them. Often we need to kind of retrain our brains, which is not easy. No one is born with these skills. You have to learn them over time, which is hard. But when thinking our negative thoughts, we often need to identify them as thoughts and not facts. A lot of the times we think these things, but is it actually based in evidence, or are we just thinking worst case scenario? So the chart here that I have on the screen, so this is an example of how to work through to challenge a thought and also to create a balanced thought from the first thought. So it is, if anyone knows any different therapies, it is similar to cognitive behavioral therapy thought record, which is identifying the thought and then trying to work through the thought in order to balance it, which can help reduce our anxiety. So first, we have to identify the thought. So when we're feeling anxious or stressed, we identify the thought, we write it down, and we write down like what we're thinking and feeling. Then once we've identified the thought, we challenge it. So we ask ourselves, is this true? What's the evidence? Has this happened to me before? Has it happened to anyone else before? Is there a more realistic way to look at the situation? How have I coped in the past? What are the end results or the probability of this happening? And then we can ask ourselves, is this even something that I can control? So if it's in our control, we can try and think of possible possible solutions and focus on our power to change certain things and make a plan of action. But also a lot of the times these things are not in our control. And sometimes we have to accept the uncertainty, which is not easy, and focus on the things that we actually can control in these situations. So, for example, even with some of the patients I work with, we can't predict the future, but what are the things that we can do in this moment to potentially influence the future? So, for example, maybe with some patients with transplant, it might be what are the things that we can do to be the most successful with our transplant? Drinking our water, taking our medications, coming to our visits. Those are the things that are within our control. And it's almost accepting the things that aren't in our control, which is not an easy thing to do. And everyone thinks about all the things that are going to happen in the future. But that's why we sometimes need to retrain ourselves and try and balance the thoughts. And then the last would be balancing the thought. So after we work through all these questions, seeing if we can come up with a more balanced thought. So I do have an example of this. So if the situation is someone who's newly diagnosed with aHUS and the thought that they're having is, I'm weak, I should be able to handle this diagnosis. My doctor should be able to cure my diagnosis. My friends and family won't want to be around me anymore and won't support me. So through that statement, you can see some thinking traps already. Labeling, saying I'm weak, saying that I should be fine or my doctor should know everything. And then also mind reading, assuming that my family and friends are not going to be there for me. So through that, the questions I might ask myself would be for the challenge. Would I say this to a friend in the same situation? Is it realistic to expect myself or my doctor to control everything? What is the evidence for or against this belief? And have my loved ones given me a reason to believe they won't support me? So if we go through the challenge, first off, for the I'm weak, I should be able to handle this diagnosis. Getting a chronic illness diagnosis is hard. Struggling is normal. That doesn't make me weak. I faced other challenges in the past, and I've made them through it in the past. This might look different, but I have different strengths to me that I can face these challenges. For the thought, my doctor should be able to cure my diagnosis. My doctors are the expert, and this condition is not curable. However, it's manageable, which can be the goal. And then my friends and family won't want to be around me anymore, won't support me. My loved ones may not know how to support me, but they do care for me and want to be there for me, and they have been in the past. So a balanced thought would be, it's okay to feel upset right now. This is a lot of new information, and I'm doing the best I can right now, and that's enough. My doctors can help me manage my diagnosis and get me support for coping as well. And I should reach out to my family and friends for support, so I do not need to go through this alone. So by creating this balanced thought, I can recognize the strengths that I bring to the table while also still recognizing that this is hard and there are realistic challenges associated with it. Okay. So on the other hand, challenging our negative or difficult thoughts can be helpful when we're in the right mindset. However, if I'm in an overly emotional state of mind and I'm not calm, it can be difficult to challenge those thoughts and think through these things to actually balance the thought. So sometimes we need to find other ways to challenge thoughts and interrupt the cycle of worry to then be able to be in that calm mind and be able to challenge our thoughts. So as mentioned before, we can interrupt the cycle of worry with distraction, but as I said, it's important we don't ignore these feelings forever. Sometimes we need distraction in the moment, but that doesn't mean we're using distraction forever. We do need to address the thoughts or feelings at some point. So examples might be getting up and moving. By focusing on how our body feels when you move, you can also interrupt the flow of worries. This could be through meditation, progressive muscle relaxation, deep breathing, or through practicing mindfulness. So mindfulness is acknowledging and observing your worries, letting the worries go, and then staying focused in the present. And then another way to support our mental well-being is managing our stress. So stress is normal, but we do not want to be high stress all the time, as it can impact our daily life and health. Managing stress techniques are similar to things already mentioned. So talking to someone we trust, adapting a relaxation practice, for example, mindfulness, into our daily routine, promoting positive sleep hygiene, getting active. Even if you have limited mobility, there can be creative ways to get active. And then another way could be finding coping statements for yourself that ground you when you're stressed, so you recognize your strength and move forward. So for example, I'm allowed to feel this way. Struggling does not make me weak. It means I'm human. I don't have to carry this alone. There are people who care and want to support me. Or I can't control everything, but I can take things one step at a time. And then last is finding joy and meaning in everyday life. So your medical condition doesn't have to define you as a person or define your family. So it's important to find ways to do activities that give you meaning, purpose, and joy in life. And these are things that define you as a person and not your health issues. If your medical changes lead to being unable to pursue these activities, there's ways to find new activities to enjoy. This could be through sports, family, friends, events, video games, art, really anything. And then everything I mentioned is applicable for caregivers and people who are diagnosed with aHUS, but these are just some additional small tips for caregivers. So being a caregiver or support person for a person with a chronic illness can have its own complicated feelings involved. For example, emotional stress, vigilance and concern, social isolation, impact of family dynamics, financial stress, and exhaustion. So what can you do other than the things that I've already mentioned? Empowering yourself as a caregiver, being engaged with the medical team, asking questions, going to things like this today, talking openly, embracing your hobbies, setting realistic goals, and also future planning. And then also parenting a child with a chronic illness can have its own challenges as well. So it's important not to rush the grieving process, and that there's no timeline for your emotions, and try and focus on the present situation rather than thinking about what the future might look like. But also you can recognize all the things that your child still will be able to do with their lives, even with a chronic illness. It can often be easy to focus on the limitations, but it's important to focus on the strengths as well and build on the strengths that we already have, including with our children. And then this is some peer support groups. So the Kidney Foundation of Canada has peer support and then support engagement groups, as well as a private online discussion forum. So some of their groups include living with reduced kidney function, caregivers, pediatric caregivers, transplant, young adults, and then dialysis, and then more. And then you can also look on the aHUS Canada's Facebook page and website for the latest information and connect with them at any time as well. There's also international closed Facebook groups that patients can join. And then you can also ask your medical team if they have support within the medical team or ways to connect you with other patients. So at Sick Kids, for example, if you asked us, we try and find ways to connect with other patients, obviously with their consent, for people who've been through this before, and can maybe be a support within that.
I just wanted to also let you know, like just last night when we had the dinner, one of the patients actually just started a closed WhatsApp group. So if you are at all interested in joining that, just let me know and we can add you to that group as well. Also, just to let you know, with the aHUS Canada Facebook page, it's just our page. It's not something that you can just communicate with each other, but you can certainly reach out to us. And then we're also thinking of making our own Canadian aHUS Facebook group as a closed group just for patients. Mm-hmm. And then one thing that I wanted to add that I forgot to mention it to you, and it just popped up as you were talking as a caregiver, just for Ontario, there's also the Ontario Caregiver Organization, which OCO, which is an absolutely amazing organization. I've been listening to a lot of their webinars, and even if you're like all over Canada, they do have like webinars that you can just sign up to it. They're all free, and usually there's like certain sessions, like maybe like eight weeks in a time, that they have a specific topic that they talk about. So if you want more information about that, I can also give you the link, and otherwise I can send it out in an email.
Thank you. There is a lot of great resources out there that continue to pop up. So it's also just staying connected with people, because then different people know different resources.
Join me.
Thank
thanking
you.
Melissa once again.
Thank you.
Thanks, Melissa, for really a great talk. And you see in terms of the resonance how important this topic is to be addressed.